Hi, my name is Jenny Thompson, and I am a first year clinical herbalism student at ITM in Toronto. Today, I would like to talk to you about gastroesophageal reflux disease, or GERD for short. I'll be covering what GERD is, what it's been misdiagnosed as well as how to differentiate its symptoms, how the GI system works, and why the symptoms of GERD arise, likely causes of GERD, and the lifestyle changes to be made to repair the damages caused, damages that can occur over time if it does go untreated, treatments from conventional medicine such as surgery, and herbal medicine recommendations and alternative options if the initial herbal treatment is ineffective. And then we'll go over some food and lifestyle to avoid as well. So GERD is often misdiagnosed as heartburn, as pyrosis is the main symptom, but GERD occurs when the acid created in your stomach to help with digestion flows back up through your esophagus due to the decreased tone of the lower esophageal sphincter, or the LES, which essentially is a little flap with a circular band of muscle that stops anything from coming back up, note the reflux. So this happens when the acid reacts to the unprotected lining of the esophagus and the feeling of heartburn occurs. So your stomach mucosa is made up of little gastric pits with cells that secrete things like hydrochloric acid and pepsinogen to help with digestion, but they can be really hard on the mucosa. So the stomach is protected by a bicarbonate-rich mucosa, but your esophagus, that's there to help with the passage of food, is protected against abrasions from your food and as you swallow, but not protected against the HCl or and the pepsinogen. So when food passes through, your LES relaxes and it goes through. It's done using pressure in your body. And when the pressure is lower than normal, the sphincter loosens and the gastric acid that I talked about comes back up, and it reaches the unprotected esophagus. This can also be caused by not enough stomach acid signaling the LES to actually close. So some degree of acid reflux is normal, and eventually the esophagus will push it back down and saliva will neutralize the acid. But when this is happening frequently, like 2 to 3 times a week, then we'll consider it GERD. So some common symptoms of GERD include a burning sensation in your chest, as heartburn, usually after eating, and it might worsen at night, some chest pain, some difficulty swallowing or dysphagia, regurgitation of your food, a chronic cough or laryngitis, which is caused by the reflux going up into the pharynx and the larynx, which can also lead to asthma. So differential diagnosis, these symptoms in response to GERD worsen when you're laying down. And some of these symptoms, you may think that an angina is going on or a heart attack, but with GERD, there is no pain in your neck. So a hiatal hernia could be happening as well, and it occurs when the upper part of your stomach bulges through the large muscle separating your abdomen and your chest and your diaphragm. A small hernia usually goes it's usually there without any problems. You may not even really know that you have it, but a large hernia can allow food and acid to back up into your esophagus, leading to heartburn. So self-care measures or medications are usually put in place to relieve the symptoms, but a very large hernia might require surgery. So persistent acid reflux will cause inflammation and more severe damage. So if this doesn't go treated, and over time, chronic inflammation in your esophagus can cause things like an esophageal stricture, where scar tissue is formed in your esophagus and it narrows the food pathway and it leads to problem swallowing. An esophageal ulcer or an open sore in your esophagus. So the stomach acid, like I said, can tear away at the tissue of the esophagus and leading to open sores. Bleeding, pain, and obviously difficulty swallowing there again. And then there's something called Barrett's esophagus. It's a precancerous change to your esophagus where the damage from the acid causes changing in the actual tissue lining. And these changes can unfortunately increase your risk of esophageal cancer. So treatments from conventional medicine are things like antacids, your over-the-counter Tums, for example. These aren't overly effective and they're only there to help with the short-term fix. So they can also cause issues like a buildup of calcium in your system, which can lead to kidney stones and things like that. So another thing that's used, or another medication, that's used is a histamine blocker. H2 blockers, they're drugs that help lower the acidic secretion in your stomach, or a proton pump inhibitor, or PPI, which is a drug that blocks the 3 major pathways for acid production. as well as prokinetic agents, which enhance the activity of the smooth muscle of your GI tract. If none of these are working, a surgery could be administered, the Nissen fundoplication surgery, where they take the gastric fundus or the top of your stomach and they wrap it around your lower esophageal sphincter to tighten up and help with that tone, making it less likely that the acid will come back up. There are a few exams that can be given. I'm only going to cover a few today just for time's sake. So an endoscopy can be administered. So the doctor inserts a small tube with the camera into your mouth and then down into the esophagus to check the lining of the esophagus and the stomach itself. This test can detect some complications of GERD, especially Barrett's, for example, where there's that damage there, but only about half the people with acid reflux disease have visible changes to the lining of their esophagus, so not always effective. A biopsy could be done by a gastroenterologist, where a tiny surgical instrument is put in and a small piece of the lining of your esophagus is removed and sent, sent away for testing to see if there are any underlying diseases like esophageal cancer, for example. And then there's pH monitoring, where a sensor is put into your nose and into your lower esophagus, and it's left there for 24 hours, and then you're monitored essentially. So as you're eating, you're recording things in a diary, and you push a specific button on the recording device to indicate when you're experiencing that reflux there. And then the journaling and the monitor will be compared, and they'll go from there. So some herbal medicine, lifestyle, and nutritional advice. For the acute symptoms, we're going to use a demulcent to help soothe and coat the tissue of the esophagus to protect against the acid. So our Althea officinalis, our marshmallow root, our Almus rubus, our slippery elm, our aloe vera, and our GGL, or licorice. For the chronic symptoms, we can use digestive bitters that help with our digestive enzymes. However, we don't want to use these until the initial stages of treatment have been administered, as they can cause a little bit more damage there. But we can go with our astringent vulneraries to tighten that lower esophageal sphincter mucous membrane, and carminatives to help with bloating, but making sure that we're avoiding any warming carminatives like ginger, for example, that can cause a little bit more damage as well. And of course, our anti-inflammatories that are used to reduce the localized mucosal reactions. So our Hydroxys canadensis, or our golden seal, great astringent. Keep in mind that it's endangered, so it's going to be one of our backups. Calendula, great vulnerary, and our plantain or plantago as well. The digestive tincture made from the bitters and carminatives to take before meals. We have our Taraxacum officinale, our dandelion leaf, our artichoke leaf, our German chamomile, and our fennel. Fennel's there for the taste for sure. It's also a great carminative, but it's good in tinctures as it's a little sweet. Personally, not my favorite flavor, but I know a lot of people appreciate it in their tinctures. For our Althea rad, our marshmallow root, we can do a cold infusion. So it's 3 teaspoons of the root with 3 cups of distilled spring water at night. We'll put them in the fridge, let them infuse while we're sleeping. And then throughout the next day, you're going to consume it. So we're going to start low and slow, a 1/4 cup, and work our way up to 3 cups a day. And this is for our acute support here. And then we can do, for our chronic support, we can use our chamomile. So we'll do a nice hot infusion. We'll do a nice warm tea, 2 to 3 teaspoons of the herb and 1 cup of boiling distilled water again, and let it sit infused covered for 10 minutes. Drink 3 times a day. Who doesn't love a good cup of chamomile tea? And then our digestive tincture, we're going to take 1 teaspoon before meals. We're doing 100 ml, so we're doing equal parts 25 ml of the 4: dandelion, artichoke, chamomile, and fennel. Our nutritional considerations here are our raw veggie juice. So our carrot and cabbage can help with instant relief. We're going to up our vitamin B complex intake to help aid in digestion. We're taking 1,000 to 2,000 IU daily. Avoid food combining here with proteins and carbohydrates. So we're not going to have them at the same meal. We're going to separate them throughout the day, and we're going to try taking apple cider vinegar. So it's 1 ounce before meals. Quick shot, a little intense at first, but you get used to it. It's not so bad. I can say this because I've done it, which is helpful. We're going to remove alcohol and caffeine for sure, our carbonated beverages as they just push air right back up, our chocolate, our citrus fruit and our juices, our tomatoes and tomato-based foods as they're super acidic, raw garlic and onions, peppermints, unfortunately, it lowers the tone of the LES as well, spicy foods and fried foods that are high in fat. Our lifestyle recommendations are losing weight, stopping smoking if you do smoke, it weakens the LES. We're gonna not eat 3 hours before bed, so we don't have any food in our stomach or we've started our digestion before. We're gonna eat more frequent but smaller meals to help lower that stomach acid production and avoid tight fitting clothing like Spanx for women. And sleep propped up instead of laying flat. So there are pillows that you can use or your own pillows and just elevate yourself a little bit as you're sleeping. So your neck and your back and your shoulders, for example. If all of this is caused by the hiatal hernia, surgery is needed, but you can also massage the connective tissues, or something I found very interesting is hanging on monkey bars to stretch out your torso, which who wouldn't want to do that? So pregnancy can also bring on GERD. I think about 80% of women experience GERD during pregnancy. So the lifestyle suggestions are the same as above, but we're going to add a few more demulcent herbs like kudzu, for example. Something else I read very interesting with pregnancy is for acute symptom relief is eating a baked potato. So something I'd be interested in trying. Thank you so much for listening to my presentation, and I hope you learned a little bit today about GERD.